Welcome to the Waiver Consulting Group. To establish a personal care services PCS in Wyoming, follow this concise roadmap based on Wyoming Department of Health WDH standards. Personal care providers assist with activities of daily living ADLs like bathing, dressing, and mobility. These services enable individuals who are elderly or have disabilities to live independently under the Community Choices Waiver CCW or the Wyoming Medicaid State Plan. To become a provider, start with the first step. Pillar 1. Business and State Authorization. Register with the Wyoming Secretary of State and obtain a Type 2 NPI. You must enroll via the Wyoming Medicaid Provider Portal to serve state plan or CCW participants. While Wyoming does not require a separate home care agency license for non-medical care, you must be certified as an HCBS provider by the Division of Healthcare Financing to bill for waiver services. Next step, Pillar 2, Staffing and Compliance. Ensure all personal care aides PCAs are at least 18, clear a criminal background check, and pass the Wyoming Central Registry Abuse/Neglect screening. Staff must hold valid CPR first aid certification and complete competency training in infection control and ADL support. Your agency must have an RN supervisor to oversee care plans and verify the competency of all direct care staff. The last step is Pillar 3, Operational and Billing Infrastructure. Implement a system for electronic visit verification EVV, which is required in Wyoming to track real-time service delivery. All services must be authorized in the participant's individualized service plan ISP developed by a case manager or public health nurse. Submit claims through the Conduent Medicaid portal using the specific codes for the waiver or state plan program you are serving. If you need help navigating Wyoming's HCBS certification, setting up EVV, or drafting your policy manual, Waiver Consulting Group provides full service support. Visit waivergroup.com or call 302-888-9172 to start your journey today.